I would like to let you know that the discussion will be after Dr. Abtehal ends her lecture, and we apologize for making things too late. We are the last lecture here. Thank you.
السلام عليكم. نود نشكر إدارة المؤتمر تاحت لنا الفرصة لهذا الاستادي الصغير يفيدنا. Well, let us start. We will talk today about serum lipids. Sorry, let us back. Well, we will talk today about serum lipids in correlation to diabetic retinopathy. The aim is to evaluate the association of elevated serum lipids with the retinal complications in diabetic patients which lead to loss of vision in type 2 DM. Well, material and methods. Type 2 diabetic patients seeking ocular evaluation for diabetic retinopathy were included in our study. They were assessed for the presence and severity of diabetic retinopathy. Retinal findings were correlated to frequent serum lipid levels within the year of our study. Sorry. Well, ophthalmoscopically visible signs of retinopathy grading may not accurately reflect functionally severe disease, since maculopathy with severe visual loss may occur in the presence of moderate ophthalmoscopic signs. Systemic screening program was helpful in reflection of vision-threatening risk of diabetic retinopathy and its relation to hypercholesteremia and lipid profile control. Our study is based on a retrospective analysis of patients' data referred to our ophthalmic department over a period of 12 months since May 2017 to May 2018 for evaluation and management of diabetic retinopathy. Well, inclusion criteria were as follows. First of all, they had fitness to undergo dilated fundus examination with best corrected visual acuity by Snellen chart, color examination, pupillary reflexes, and estimation of intraocular pressure with detailed fundoscopy was done with direct ophthalmoscope and slit lamp biomicroscopy with Vogue lens. Well, this is short notes. I know that all knows what's going on about severity of ophthalmoscopic signs in retinopathy. First of all, we divide with non-proliferative stage, background, proliferative maculopathy, and advanced diabetic eye disease. This short notes about what's going on. First of all, pre-proliferative, which indicates progressive retinal ischemia, then proliferative diabetic retinopathy, then with maculopathy and advanced diabetic eye disease. Well, this is an images of what's going on inside the retina with changes of vascular pattern and new vessel formation in disc. This is another images of exudation with changes of blood vessels. So this is another image of exudation around the macula. Well. Well, this is a case of vitreous hemorrhage, and this is our interest for this study. You see the level of hemorrhage is earlier than the retina. This is an image of retinopathy patients. You see that the image is not clear. All patients with retinopathy see ghost-shaped based images. Well, diabetes mellitus is defined as a metabolic disorder of multiple etiologies characterized by chronic hyperglycemia and disturbance of carbohydrate, protein, fat metabolism resulting from defect of insulin secretion or insulin action or both. Well, our trial study includes 196 patients with follow-up and estimation their result according to our lab test with fasting blood sugar, HbA1c, serum triglycerides, serum cholesterol, and HDL and LDL. Totally 196 patients were included in our study, of which 98 per 196 had diabetic retinopathy of any grade. 25 per 196 patients were presented with vitreous hemorrhage. One eye and the other eye had diabetic retinopathy of different grades. All have DM more than 10 years of both gender. Age group is 42 to 74 years. The trial was done between May 2017 to May 2018. This 196 Iraqi patients were divided in two groups. Group 1, number 73 clinically healthy control subjects. Group 1A, number 73 clinically having hyperglycemia and dyslipidemia. Group 2, number 25 clinically having elevated serum triglyceride with serum cholesterol level, but HbA1c was around 7. So the result, it seems that elevated serum cholesterol were not significantly associated with retinopathy of different grades. Other results did not find any correlation between elevated serum cholesterol and vitreous hemorrhage. There is a highly significant result in patients with different grades of diabetic retinopathy having hypertriglyceridemia compared with healthy control group. Patients with hyperglycemia but not normal serum lipid level showed highly significant values with retinopathy of different grades. The other results our trial, however, showed a relationship with occurrence of vitreous hemorrhage in patients with elevated serum triglyceride while HbA1c was around 7. Well, this is a diagram showing us the mean value for fasting blood sugar in retinopathy patient and the control group. The first diagram is the fasting blood sugar with retinopathy patients according to the other, which is fasting blood sugar within the normal group. This is another diagram showing the mean value for serum triglyceride in retinopathy patients and normal group. That's the far away diagram is with retinopathy patients, and that one is with the normal group. Well, this is the mean value for fasting blood sugar in vitreous hemorrhage patients and control group. This is the normal, and the other one is with the vitreous hemorrhage features.
Finished. Dr. Abtihal, okay?
Finish بس بقدر. Well, just the p-value, please. Well, here is the p-value. This is the p-value, which is significant with triglyceride according to the cholesterol group. And this is the p-value in the studied group for the vitreous hemorrhage in triglyceride group. Well, conclusion, diabetic retinopathy affects over 93 3 million people worldwide and is one cause of blindness among working age adults. These indicators, coupled with project rise of patients diagnosed with diabetes, makes diabetic retinopathy a serious and prevalent vision-threatening disease. It's enough. Thank you very much.
Thank you very much. Now the time for discussion. Anyone have a question for our presenter? Any question for Dr. Hassanin, Dr. Sohaib, or Dr. Zaid? So no question. Thank you very much for your listening.